I'm Mike Merson, the director of the Global Health Institute. I want to welcome all of you to our ceremony celebrating the graduation of our Master of Science in Global Health students. Let me first welcome our families and friends who have traveled from other parts of the country and the world. I talked to a few of you, and I met someone from China, Taiwan, Seoul, and Uganda. So this is a very international celebration, and we're happy to welcome all of you, but particularly those who came so far. I also want for all of you to, if the students will allow me, to introduce some of our faculty over here who helped our graduates reach this milestone. If they would just stand, and if we could just thank them for all they've done. This is the only time of year where the students clap for the faculty. So we're very happy to see that. So we have 32 graduates, 2 from last fall, including 2 from last fall and 1 from last summer. You 32, you are going to make your mark on the world, I'm sure, and that you're going to do your part to advance the world's health. This is a very exciting and challenging time in our field. At times, as you've learned, it can be frustrating, but it is often very fulfilling. And you have a real potential now to make a real impact. Just from our news, we know that the world needs you more than ever. And I'm counting on you. We are all counting on you to achieve your dreams. And I want to wish you all the best in your future endeavors. Before we move on with the ceremony, I just want to invite everyone to join us for a reception outside the back doors immediately following the ceremony. We're also going to take a class photo. And speaking of photos, we will post a link to the photos taken by our professional photographer during the ceremony in next Tuesday's Institute newsletter, and they may be downloaded for free. In case you're worried about getting pictures, you will also have that opportunity to download them. And I'm sure your sons and daughters and family can tell you how to access the newsletter. So my last task is to welcome Melissa Watt, who's the director of our Master of Science in Global Health program. She's going to give her reflections about our graduates and their future, and then we'll move on to the presentation of awards and degrees. Melissa, welcome.
Welcome, everyone. It is so nice to have you all here to celebrate this important occasion in the lives of our graduating students. To the family and friends who are gathered here today, I want to thank you on behalf of the students, the faculty, and the Institute for all the support you have given to these students over the last 2 years. Graduate school is like a roller coaster. There are highs and lows. There are these moments of incredible anticipation and oftentimes fear, often followed directly by exhilarating joy. And then, just like a roller coaster, you get to the end. And I know that many of you have been looking around today and saying, wow, that was fast. Even though during the time you thought, when is this ever going to end? If you're a loved one of someone who's been on that grad school roller coaster, you have probably seen all this and more. And it might have made your head spin a little bit. I want to thank you for standing by those students, for giving them the encouragement and the perspective to make it through these past 2 years and to succeed in the way that they have. To the graduating students, we are so proud of you. It really does feel like yesterday when we were on that sticky field in Bahama, North Carolina. I had to say that like a North Carolinian that I am. And throwing around a rubber fish and trying to make a seesaw balance. We were all getting to know each other then. And I would have to say that I think those team building exercises were very successful. Because look at you all now. You are a group of diverse people, individuals from all over the place, all different backgrounds, sitting here together as a community. And you have supported each other and encouraged one another. You've gone through biostatistics, research design, global health ethics. You have spent long nights in the library writing a thesis. You've stood outside on the hallways, often in front of my office, waiting anxiously for your fellow students to come out so that you could give big hugs and congratulatory high fives. You've shared anxieties about fieldwork, and then you've supported each other as you've been spread out all over the globe. You are a community, and as you go into this next phase of your life, that community you have formed is going to be one of your greatest assets. So look around at each other and make a commitment to yourselves and each other to nurture that community and to find strength and wisdom in that community. In the years ahead, and after many of us in this room have retired, you will be making global health history. And this idea of making history is something that I've thought a lot about in the past few months. In January, I traveled up to DC to be part of the Women's March on Washington. And the day after that, I spent the day by myself in the African American History Museum. And that weekend was such a reminder for me that history is always in the making, and that we are always the makers of that history. I think we can agree that the historical moment that we have seen over the last 6 months is particularly significant, and it has critical implications for global health. Like many of you, I attended the CUGH meeting in Washington a few weeks ago, and what I heard over and over again is the sense of uncertainty in global health. Through investments and cooperations, we have made incredible strides in global health discoveries and care delivery, from eradication diseases to delivery of services such as HIV treatment. There are so many accomplishments to be proud of, and of course, so much more that needs to be done. But we are facing a policy environment where the value of global health investments and the pursuit of alleviating health disparities are being questioned. Questions about political will, commitment, and resources all introduce incredible uncertainty. But it's these times of uncertainty when we have a choice. We can either become insular and fearful and just hope this will pass, or we can see and seize opportunity. An opportunity to define and articulate our values, an opportunity to show up in new spaces and make our voices heard, and an opportunity to reshape the work that we are doing. We have an opportunity to make history. As you move forward in your global health careers, I have some thoughts about some of the opportunities we're presented with and how we can become more effective global health professionals in the years ahead. First, we have the opportunity to be better communicators, and not just to people who think like us. I'm sure all of us can wax poetic about the moral obligation of global health investments. But we also need to provide convincing arguments about how global health impacts our national and economic security and broader geopolitical stability. We need to be really good at showing facts and figures to make our case. But we also need to be good storytellers. We need to find ways to touch both hearts and minds. Second, we have the opportunity to truly commit to interdisciplinary practice of global health. This is sort of at the founding ethos of the Global Health Institute. This means continuing to work across different academic disciplines, but it also means thinking more broadly about the stakeholders we engage in our work. We have new opportunities to collaborate with private enterprises, ministries of finance, tech companies, military operations, activists, and faith organizations. As interdisciplinary practitioners of global health, we need to see ourselves as bridge builders and bring a larger group of stakeholders under the tent to solve pressing and complex problems. Third, we have the opportunity to move from problem namers to problem solvers. One of our most important roles is to bear witness to global health challenges and inequities. But we can't stop there. We must identify and implement solutions. We need the best and the brightest minds to bring innovative thinking and passionate resolve to global health challenges. And this is where we're counting on you. Fourth, we have the opportunity to renew and rethink the connection between the local and the global. This term, think globally, act locally, was coined in the 1970s in the environmental movement. And it really challenged us to think about how our micro actions can have macro consequences. And it was made famous, of course, by bumper stickers on cars across the country. This is more important than ever. But at the same time, we need to think locally and act globally. We need to think about the communities where we work, their strengths, their needs, their solutions. And then we need to scale up efficacious programs and solutions at a broader scale. And we need to examine how our macro actions have micro consequences. And finally, we have the opportunity and the need to recognize and celebrate strength and resilience, both in ourselves and in others. We're going to need it. Our peers are going to need it. Our colleagues are going to need it. Our collaborators are going to need it. But it is also, I believe, where we find our best ideas. When we are able to recognize and harness the strengths of ourselves and the strengths of the communities where we work, then we find solutions that are community-driven and that are organic and based on resilience. And then we have the best chance of creating sustainable change. In conclusion, you are stepping off this roller coaster of graduate school and stepping into this next phase to make history. Be brave. Be kind to yourself and to others. And don't forget that you will always be part of this DGHI community. So at this time, it's my pleasure to introduce the student speaker, Michelle Roberts. Michelle joined the Masters of Science program after completing her bachelor's in anthropology and political science at Auburn University. As a graduate student, Michelle worked with Janet Becker to examine the care of neurology patients in Argentina. She served as a teaching assistant both in Gavin Yammy's Global Health Policy course and also in Yves Puffer's Global Mental Health course. Michelle was nominated by her fellow students because she is a community builder and because she really exemplifies the grit and determination of being a graduate student in DGHI. Michelle, please come forward.
Hi, good morning, everyone. I'm honored to have been selected by my classmates and DGHI as the Seer Student Commencement speaker. I hope to honor the graduating class with my words and sentiments today. Before I get to what I hope is the funny part, I'd like to thank everyone who helped us get to graduation today. Our families and partners, our mentors, the faculty and staff of DGHI, roommates, and everyone else who has supported us throughout this process. I also want to thank my classmates, because I don't think we could have done this without one another. So, who remembers this fish? So, this fish is what I remember from my first week of orientation to the master's program in global health at the Duke Global Health Institute. This fish. And for those of you who might be a little confused, the new master's students were supposed to go to a ropes course for team building during our orientation week. And in retrospect, this may not sound like a big deal at all, but it was actually kind of nerve-wracking. Here we are, first week of graduate school, wanting to make a good impression. And Duke doesn't typically admit graduate students based on our physical abilities, which was certainly true in my case. So the idea of showing off all the balance and upper body strength I don't have on a ropes course wasn't my favorite idea. Luckily, though, it rained that day. But team building wasn't canceled. Instead of doing a ropes course, we played a series of get-to-know-each-other and team-building games, one of which involved this fish. The object of the game was to have one person be it and stand with his or her back turned to everyone else. And then all 30-ish of us had to run with this fish towards the person. But the trick was when the person who was it turned around, we had to freeze. And if they caught us moving, we had to start over. If they could guess who had the fish, we had to start over. So while this seemed pretty straightforward in theory, it actually took quite a while for all 30 of us to get the fish to this person. And quite a few of us had this fish thrown into our face. A little more. And this was hilarious. Imagine all of us bright-eyed and bushy-tailed, 2 years younger, ready to start our careers, fighting global health inequity, and trying to sneak this stupid fish around without being caught. And we did not know each other at all. But somehow it worked. And I'm sure one of us could draw a logic model or do some sort of evaluation and see if this actually built a team. But I only get 10 minutes, and I don't think anyone wants to. So now 2 years have passed, and we're here together today, graduating. All of a sudden, it seems like we completed coursework, fieldwork, defended theses, all of that. But to be honest, I sometimes struggle with what may seem to be a basic question I'd like to figure out before we get our diplomas in a few minutes. What is global health? This is probably where our families start wondering what we've been doing here for 2 years. But seriously, what is global health? I think it's a question that warrants our attention. And I'm sure each of us has been asked, what is global health? From family, friends, a stranger in front of you in line at Chipotle who insists that you must be a doctor. I'm not a doctor for the record, though some of us are. And when asked, I've defined global health in a variety of ways. Sometimes altered to fit who I'm speaking with, or maybe what I've just studied, or how I feel about the field that day. And I can talk about the use of methods effective in low-resource settings, the global shift to address non-communicable disease, the effects of globalization, and the need to recognize how health transcends national boundaries and biomedical paradigms. But what is global health? And maybe it is a bad sign I'm still asking this after 2 years. But I promise I did learn something for this degree, asked my thesis committee. So thinking about what a good definition of global health would be, I turned to PubMed, our favorite research database, as one does, and there I found an article in Global Health Action that asks the same question. And the authors write, Copland et al. Define global health as an area for study, research, and practice that places a priority on improving health and achieving health equity for all people worldwide. This is a useful definition with a broad focus on health improvement and health equity. However, it is wordy and uninspiring. And that's what an article said, that it was wordy and uninspiring. And what a thing to say about global health. It's true the definition might sound broad and somewhat passive, but I have to disagree with any definition of global health that reduces the field to such an uninspiring chore. A recognition that there is some inequality in the world somewhere, and yeah, we should probably do something about that. I believe the difficulty in describing global health is caused by the very thing that makes it so powerful. Its broad focus, interdisciplinary nature, and emphasis on complex problems. The definition that Beaglehole and Benita cite is from an article in the Lancet titled Towards a Common Definition of Global Health, written by several prominent global health scholars, including our own Dr. Mike Merson. Throughout the article, the authors emphasize the need to reach a common definition to best serve the discipline and health of people around the world. At one point, the authors offer this definition. Global health can be thought of as a notion, the state of global health, an objective, a world of healthy people, a condition of global health, or a mix of scholarship, research, and practice. And at its core, global health is an objective. Global health is a psychologist validating a mental health instrument for use in a refugee camp, a doctor administering antiretrovirals, a community health worker assisting a woman giving birth, and even a classroom of students learning biostatistics and epidemiology. We are engineers, nurses, anthropologists. Some of us are doctors, psychologists, writers, or policymakers. What it comes down to, though, is that we are people who insist on making a difference. And global health is just that. Global health is people taking action, hoping that that action makes a difference. According to a report from the Commission on Investing in Health, we could avert 10 million deaths per year by scaling up existing technology and health services. 10 million deaths just by doing the things that we already know work. And Paul Farmer said, and of course in a global health speech I have to quote Paul Farmer, equity is the only acceptable goal. And that is global health. Or at least that's what I believe it should be. Global health is action, action by people in their communities and action by engaging communities. And as we graduate and go into academia or consulting, business or public service, clinical practice, science, social science, or the arts, we are global health. We are the future of the field, and we have a duty to remain true to the principles that called us to global health. It isn't hard to do global health badly. When there is so much at stake, it is easy for things to go wrong. But this shouldn't be an excuse we comfort ourselves with or a way to rationalize suffering. This should be our call to action, our constant reminder that global health is needed and needed badly. We have a duty to not only take action, but to continuously question the actions of others, to continuously ask ourselves, what is global health? We have a duty to recognize the power for real change lies in harnessing the social and cultural power of people, those for whom the experiences we study in global health are daily reality. And we have a duty to practice global health, and to do so in a way respectful of and appropriate to the community and culture we're working with. So, when we first threw this fish to each other, we didn't know each other, and I'm guessing none of us was expecting to throw a plastic trout. I certainly wasn't. But in the interest of coming together, we threw the fish. And this is where writing my speech, I thought about throwing the fish back into the audience and completing my grand metaphor, but I've decided against it. I think everyone will thank me for it. And when we threw that fish, we hadn't spent hours on biostatistics or debating the ethics of humanitarian aid. We hadn't completed fieldwork or defended theses. Those things were expected and required. But like with this fish, we've also done a lot of things that we didn't expect. When we threw the fish, it was a small thing, but it was asked of us, and we did it together. Now we have studied together, celebrated together, and are graduating together. We've completed the expected and done the unexpected. We have studied global health together, and now we must practice it. So congratulations to the graduating class of 2017. Let's tackle the expected and confront the unexpected, and remember there is a time and place to throw a fish. Above all, let's remember that global health is a field defined by its objective, and that ultimately our commitment to health equity accompanies the hope that someday our work may become obsolete and we may not need global health anymore. Thank you.